My name is Michael. I'm a patient of Dr. Lau's at Valley Medical Center. I literally just woke up one morning and I went and had some food. I ate breakfast and it just didn't feel right. There wasn't it wasn't pain. It was more of, I just felt really sick, but I knew it was something that wasn't normal. But strangely enough, I said that I needed to go to the hospital, and I ended up staying for a month and a half. The hernia started right away. I stuck out pretty far. It was pretty lumpy. The scar tissue was about that large, so you could actually see the ridges of my intestines and movement. It wasn't until I met up with my doctor there. She's the one that told me that I needed 3 surgeries to correct it. They did the scan, she told me I had a hernia, and then she was like, unfortunately you developed a diastasis, your abdomen isn't going to close. It didn't really register to me to seek other doctors. That's also another thing. I had never done this before. I didn't know that it was common to go to a different doctor once you started, to almost kind of do an interview process with different surgeons.
When I first saw Michael, he was about a year out from emergency surgery. It was a very complicated course for him. He also was left with a large hernia, so basically a separation of his abdominal wall muscles in the middle, creating a defect in what we call the fascia, which is the strength layer of the abdomen. And so basically his intestines were just popping through and were just right underneath the skin. So Michael was in pretty difficult condition when I saw him.
And it wasn't until I came to Valley and met with Dr. Lau that there was a confidence level that was so different. He was just very a matter of fact. It was the first time anybody had shown me imagery, and that was really important to me. To know what was going on with myself. I was like, you don't need 3, you need 1. It just is kind of, this is what we're gonna do, and walked me through it and was able to, and then I switched doctors.
As we spoke about before, Michael's incisional hernia was very large. And so to bring his muscles back to where they were originally was a pretty big undertaking. So I knew that Michael really needed what we call an abdominal wall reconstruction. So I explained to Mike that that's what we would have to do, was to separate some of the muscles on the side, so to allow them to slide so that the bigger muscles, the rectus muscles, could come back towards the middle and therefore take care of his hernia. And we would also use something called mesh, which we use in most of our hernia cases as a reinforcement of his reconstruction. So most of these abdominal wall reconstruction operations are done robotically. Michael was somewhat of a special case, mainly because of the large size of his hernia and his slender build.
I woke up here, and Dr. Lau came in, I started crying. I hadn't really done a whole lot in years, and it just felt great. All of a sudden I was getting back to normal.
Michael had a really good recovery. He was very motivated to be active and to be up and ambulating and exercising within reason right away. So he really did well in terms of bouncing back from this operation.
I appreciated so much how thorough everything was and how much was explained, sitting down and really talking through what was going on, what was going to happen. That was something that was really important to me because, of course, it's your body. You need to know, you want to know. I just appreciated how thorough everything was.
Well, my approach in caring for patients, I like it to be a collaborative approach. I feel that a patient really needs to understand what's going on with their disease process and what I'm recommending for them before we move forward towards the operation. And Michael had a lot of questions, but he really understood why we had to do a stepwise approach. And by showing him the images and showing him how massive his hernia was, he really understood why we needed to reconstruct his abdomen to get him back to where he was before, at least close to it.
Once you get to that point where the light's at the end of the tunnel, it's like, all right, things will get better. It can only get better. That's all that can happen.
But here at Valley with my team and my partners, we're able to tackle some of these more difficult cases. And not only in hernia surgery, but my partners do also colorectal surgery, endocrine surgery, breast surgery, and several of my partners in fact, all of them used a robot. And so we're doing fairly advanced operations here at Valley and can tackle some pretty difficult cases.
I really did want to go to somebody who really specialized and I trusted. I truly swear by this hospital.